Hello, everyone. Welcome to February's Direct Connect. Direct Connect is a virtual forum of youth and young adults, and it's pretty much there to help us develop our professional skills, access training opportunities, and connect and share resources. I'm Jasmine Boatwright. I am the Programs Coordinator with Youth Move National. Today's topic will be on understanding the career pathways for the young adult workforce. And this topic will be presented by Brianne Masselli, Lydia Proulx, and Alice Tapaloff from Youth Move National. Before we get started, I wanted to remind you all to use the chat box for any of your questions or comments, and let us know if you need anything. Today's learning objectives will be on understanding the demographics of those with lived experience who are working in the field, discussing the roles and responsibilities of those with lived experience working in the field, and increasing understanding of readiness and professional development needs of those with lived experience. Now I'll hand it off to Lydia.
And so we're going to really look at this data and provide some insight into how to best support this emerging workforce of young people with lived experience. So if you look at this chart, I apologize if it's a little blurry, but in the PDF I am told it is much clearer, so feel free to download it and read it a little bit later if you need to revisit it. But our first sort of set of boxes tells us that organizations benefit because providers' lived experience increases credibility with young people. We know that young people, if someone has been there, done that, we know that they understand our perspective, where we're coming from. Organizations benefit when lived experience can inform program design. So when young people are engaged in the development and implementation of programs or initiatives, we know that they are going to do really well at reaching other young people. And informed program design can improve engagement. So again, if we include the folks who are going to be served by the program, we know that it'll reach other folks who need to be served by the same program. Youth peer providers benefit, so the young adults actually working in these roles. It reinforces self-esteem. It establishes growth for when peers age out. So we know that, unfortunately, we can't all remain youth and young adults forever. We do grow up and have to consider where folks are going, where we're going next in careers. Finally, it retains well-trained and invested staff. So if a young adult joins staff as a peer provider, sharing their lived experience with youth to kind of create that connection, we know that if they are supported well, mentored, given the chance to grow in their work, your organization is going to retain that staff person and possibly, they'll grow into a different role. And then lived experience will really be throughout the organization. We see that contracts are increasingly requiring lived experience, so we know that local and national contracts are starting to require lived experience for various roles when those funding opportunities come out. And there's an increase in professionals with lived experience as service providers, and where will they go over time? Looking at the intersection of lived experience and professional development and professional sort of growth, it hasn't really been tracked yet, so we're excited to kind of get that ball rolling. And finally, some organizational challenges include buying into the value of lived experience. So we know that, for example, with the family movement many years ago, that there was sort of a challenge getting folks to buy into the fact that parents had to be at the table, and same with youth being at the table. And now providers, professionals with lived experience, that is value added to an agency. And getting folks to buy into that sometimes can be a challenge. There's opportunities for growth and advancement, which means that, one, there needs to be a place for folks to go once they grow and advance, but also how do you provide the right supports to get them there? And then workplace wellness, obviously having lived experience of any kind can pose challenges and can be brought up. If you're serving a young person who has similar experiences as you, they could trigger something. And knowing that instead of leaving your lived experience and sort of your personal life at the door when you walk into work, the job is to bring that into work. And so that requires a new kind of set of self-care and sort of responsibilities and how that works. So some of our sort of challenges with this survey, and to be honest up front, is that there's very limited research who makes up the young adult workforce, who is actually part of this workforce, hasn't been clearly defined yet, and what are their professional needs. So knowing that they're going to grow and change roles over time, we're not quite clear yet on what are the professional development needs of this population, and have they been developed, have they not been developed? If they've been developed, are they adapted models that aren't really serving young adults well? Do we need to look at those closer, different pieces? And then, of course, we know that youth engagement happens on a continuum. So there are, youth peer providers who are offering peer support in very informal drop-in youth group type settings. And then we have folks who are, billing for their time by the 15-minute increment in very sort of specific and formal services. And so knowing that this youth engagement happens on a continuum and recognizing that in that there's a lot of gray area and we have to be flexible with our understanding so we can really see what patterns are emerging. Finally, just to offer this to folks, this is a quick chart of where we know youth voice and young adults can kind of participate in different areas of an agency and how they can offer feedback and be part of different advisory groups and evaluative processes and quality improvement over time. So if they're informing projects, they could help create websites, they can offer feature stories, they could participate at open houses, and they can develop fact sheets, brochures, give feedback on these items. And then if they're consulting, they might be you consulted all of us when you filled out that quick survey at the beginning. You're offering us information about you so we can kind of put together a larger picture. And as we kind of go along this continuum, eventually we see things where youth and young adults are empowered, and so they're able to participate fully in decision making. They're hired in staff roles or peer roles, like youth peer providers. They're leaders in youth movements and family movements, so youth and young adult advocates. They're part of steering committees. So they are kind of moving along this continuum, and then at the bottom we see that throughout this are our trauma-informed values of safety, transparency, trust, empowerment, choice, collaboration, mutuality, culturally responsive, and peer support. So that's throughout all of these pieces. But these are really all the areas that we've seen and know that youth and young adults, when they're engaged, can be offering their input. So real quick, we're going to define the word lived experience, and this is what Youth Move National presented in 2014 through one of our webinar series. It's available online if you'd like to go visit it. But it's having received services as a child, youth, or young adult, which is including but not limited to mental health, child welfare, juvenile justice, or special ed, or they're currently or previously lived with a mental health and substance use diagnosis. And so we know that saying currently or previously lived can be a little confusing, but what we mean by that is that some folks, when they grow up, they might think or they might have a perspective or an experience where, well, when I was younger, I had depression and now I don't live with that. So they still have the lived experience as a youth with depression, but maybe right now they don't have that challenge or they're not living with it currently. So we wanted to honor both of those pathways, both of those journeys. So when we're talking about types of lived experience positions, these are some of the words, the next few slides, that we had sort of thought about and kind of reflected upon and utilized these throughout our survey language. They're not the end-all, be-all of this language, but this is what we are working with so that we're all on the same page. So the first one is a youth worker. So those youth, young adults, and adults who engage young people in coordinated programs, including recreational, educational, or social. And youth work is often defined as activities that intentionally seek to impact young people. We adapted this from a Wikipedia article on youth work. And so this can include after school, teachers or youth ministers or YMCA coaches. This is really a very broad group of people who are working to positively impact or who are seeking to impact young people. The two main focuses of our study with these lived experience positions will be youth peer providers and sort of youth coordination, youth engagement specialists. So youth peer providers are folks, young adults, who use lived experience within child serving systems, again, not limited to mental health, child welfare, juvenile justice. They utilize their lived experience within the system and skills learned in formal training to deliver services in behavioral health settings to promote mind-body recovery and resiliency for young adults. This is someone such as a certified peer specialist, peer support specialist, youth partner. We know that many communities and many states have different names for this role. when we're talking about youth peer providers, we're talking about all those folks, those young adults who are using lived experience professionally to engage and to sort of support a young person. This definition's origin can be found through SAMHSA. Maybe I clicked. There we go. Sorry, our animation is working on some slides and not others, so I have to kind of guess which one it's going to be. Youth advocates, we define as young person, typically between the ages of 15 and 25, we say typically, who use their lived experience to educate, inform, motivate, and inspire others in an effort to create positive systems change. So this is someone who may not be working one-on-one with young people, but they are working sort of at a systems level, whether that's within their town, their county, their state, nationally, to create systems change. It may or may not always involve their own lived experience. Sometimes maybe they're bringing the stories of their peers or of younger youth they're working with, but they're advocating for some kind of change. Youth coordinators usually work for nonprofits, community organizations, or government agencies. And their responsibilities primarily include facilitation of youth programs that focus on education, leadership, personal development. They're very much like coordinating the operation of a youth serving program. And that could be informal or like a more formal piece. And youth engagement specialists we defined as a person who usually works for a youth serving organization but may or may not work directly with young adults. Youth engagement specialists might design, implement, and evaluate youth programming and outreach efforts. They may or may not work with youth and young adults on those efforts to design, implement, and evaluate, but they're someone who is thinking either abstractly, theoretically, or like practically, how do we get young people involved with this effort, whether that's a program or whatnot. Many participants, not many, some participants self-identified, and so these are loose definitions. These are not, again, these three particularly not set in stone somewhere. And as we know, again, many of us have titles that don't reflect our day-to-day job responsibilities. So just keeping that in mind. And so for this study, the development of our, for this survey, we're building off previous studies done in the adult mental health system. And so in particular, Nev Jones at the University of South Florida shared her sort of, her survey questions of adult consumers and sort of peer support and what that was looking like. And so we very much, we're trying to collect information that some folks already had and also look at some information, collect some information that maybe folks hadn't already asked these questions. Study questions were developed in partnership with Youth Move National's Youth Best Practice Committee and support from Rutgers University. So we went back and forth with sort of drafting and developing questions and then bringing it to the Youth Best Practice Committee, which has youth and young adults from across the country serving on it in a variety of roles, who kind of gave us feedback on language and, well, if we're asking this particular question, what are we going to do with that information? Are we asking this because we're curious or because there's actually, you know, a solution we're looking for within it? And we went back and forth for quite a long time until we came up with the survey that you'll see results from today. Recruitment for our survey participants was done by Youth Move National's network and strategic outreach. This included like asking, well, I'm sure many of you saw it on our Facebook or Twitter. We were posting and asking different chapters directly to have their folks fill it out. We were able to bring it to the training institutes and ask people to fill it out there. So very much like working with our partners and trying to reach a broad variety of folks within the youth and young adult workforce. I'm sorry if you can hear my cat in the background. She says hello. And I think at this point I'm going to pass it off to Bree. Oh, but first I'll ask, are there any questions regarding that section? Sorry, Bree, I didn't mean to. If you have a question, feel free to type it into the chat box.
It's okay. Lydia, next will be Alice.
Next will be Alice.
Thanks, Lydia.
I don't have my notes, so I'm sort of winging it. Thanks.
So for this next section of the webinar, we'll go over some of the results of the survey. It's going to be a lot of numbers and a lot of graphs, so if you have any questions, please type them into the chat box and we'll moderate them as much as possible. So for this first part of the data, we'll go over some of the demographics, the organization, the employer, its location, etc. And then Bree will talk about the survey respondents' level of satisfaction and feeling of opportunity for growth and career development in their positions. You'll notice that we broke down respondents into separate categories. One category was people who identified as youth engagement specialists or youth coordinators. Another category is people who identified as youth peer support specialists or youth peer providers. And then the third category was all of the respondents together, including those two previous categories. So let's get right into it. First, the respondent's age. We asked participants what their age was, and the median age of all respondents was 28 years old, meaning that half of the respondents were under 28 and half were over. You'll notice that youth peer support providers, or the people who answered and identified as youth peer support providers, tended to be slightly younger because the median age is 24, and that youth coordinators and youth engagement specialists' median age was 26. Then we asked about race. This graph shows what race respondents identified as. They could select multiple. The largest majority of respondents identified as white or Caucasian across categories. Since this survey was distributed via the Youth Move network, and we do have several tribal chapters whose surface areas include peer support, it may explain why there's a slightly higher percentage of respondents identifying as American Indian or Alaska Native. Again, for the gender question, we asked respondents to select any of the responses that they identified as. The majority of overall respondents identified as girl or woman, 75% of them, and then boy, man, 22%. We asked respondents about their sexual orientation. The large majority of respondents across the board identified as straight or heterosexual. So these three demographic slides around race, gender, and sexual orientation highlight the fact that the youth workforce is not very diverse. Other surveys that we've done at Youth Move National with our membership, such as our chapter report and our membership survey, show that the Youth Move membership is much more diverse than the workforce. And yet these are some of the folks that we're expecting will step into the youth workforce. There's also other data outside of our network that show that, for example, LGBTQ youth are involved in juvenile justice and social welfare at higher rates than the general population. There's an American Progress study that shows that although LGBTQ youth represent 5 to 7% of the nation's youth, they represent 13 to 15% of those in the juvenile justice system. So if we're going to provide peer support in these systems, the workforce should match the population a little more closely. We then asked respondents to describe the town or community in which they work, and the results were rather interesting. Most of the overall respondents worked in urban settings, 52%, or suburban settings, 42%, with only 27% working in rural settings. Youth coordinators and engagement specialists seem to mirror that distribution, with the majority of them being in urban settings. However, youth peer support providers, the majority of them said they worked in rural environments, then suburban, and then urban, so the opposite. This might be because of the lack of formal mental health services in rural environments, creating the extra value added and the need for peer support services. And we could explain the fact that youth coordinators and engagement specialists are at higher rates in urban areas because those positions are sometimes required by grants like System of Care or HT grants. And HT grants are awarded by the state, so the youth engagement specialist would then be hired as a state employee and very likely work at the state capital, so an urban area, even though they would oversee programs in rural areas as well. So the survey also asked what was the highest level of education completed by respondents. For youth peer support providers, the largest portion of respondents' highest level of education completed was a high school diploma. And for youth coordinators and youth engagement specialists, 2/3 of them had a bachelor's degree or higher, like a master's. So as Lydia mentioned previously, youth coordinators and youth engagement specialists are expected to provide oversight of programs, sometimes manage budgets and staff, and some employers, for example, big entities like state agencies or governments that hire such positions, have standard requirements like the need for a bachelor's or even a master's for that kind of position. This could be a challenge or barrier in the career continuum. Employers who hire direct service positions like youth peer support providers may want to consider encouraging or supporting further education so that these direct service positions, youth peer support specialists, can move into management positions. The support of further education could be anything from verbal support and encouragement to a flexible schedule allowing to pursue college or even tuition benefits. So after asking a lot of demographic questions and work environment questions, we asked respondents about their lived experience and their supervisor's lived experience. And because, so this graph shows the percentage of respondents who said they had lived experience in the following systems, and it's ranked from the highest percentage to the lowest percentage. And on this slide deck, we're only going to show half of the results, but I'll mention the bottom half of this graph as well. So unsurprisingly, maybe, the highest percentage is around mental health. So 85% of all respondents said they had lived experience in mental health systems. Then substance misuse and addiction recovery. So around half of respondents, maybe just a little bit higher for youth peer support providers and youth coordinators. And in this graph, it appears that youth peer support providers might have more lived experience in various domains, including child welfare, domestic violence, residential treatment, but also systems that we didn't show in this graph for readability. So youth peer support providers also seem to have more lived experience in systems like juvenile justice, vocational rehab, sexual assault, human trafficking, HIV, AIDS, military, first episode psychosis, etc. We also asked respondents whether, to their knowledge, any supervisors in their agency had lived experience, and the majority of respondents said yes. Supervisors of youth peer support specialists and youth engagement specialists tended to have more lived experience than the average youth workforce survey respondents, which is in line with best practices. This might make it seem like the employer's work culture as a whole might be supportive. However, we need to be aware that this might only apply to a very specific program or division of the employer and not the entire agency. So we asked the respondents about their employment status, salary, and their employer type. When asked what their employment status was, the majority of respondents said they worked at least 40 hours a week at one job, 63% of respondents. Not represented on this graph are respondents who said they volunteered or interned part and full-time. There are pretty low responses for that question about volunteering or internships, except for youth peer support specialists, 13% of which said they volunteered or interned part-time. We also asked how many hours a week respondents were working. 53% of respondents are working 31 to 40 hours a week, and 26% of all respondents were working more than 41 hours a week. We note that burnout is frequent in the youth workforce, and overwork is a factor of burnout. We asked respondents whether they were salaried or paid hourly. 3/4 of respondents overall said that they were salaried, with half earning less than $40,000 a year. Under 2/3 of the youth peer support specialists said they were salaried, and half of those reported earning less than $30,000 a year. The hourly breakdown is as follows on this graph. Just like for salaries, we'll note that on average, youth peer support specialists are paid less than the average respondent. We asked respondents about the type of employer they worked for. these responses are sorted from the most common responses by the overall respondents to the least common responses. So the most common responses for the average respondent was that their employer was a mixed agency with some peer-run programs and some blended programs. Then the second highest response rate was a private community-based provider, then a state, county, or city facility, and then an adult consumer-run organization. The other category, which ranks fifth, included nonprofits, religious institutions or churches, town department, and municipality. We'll note that it's slightly different for youth coordinators and youth peer support providers. Youth coordinators are more likely to be employed by a state, county, or city facility, and youth peer support providers are more likely to be employed by a family-run or youth-run organization. We also asked what roles and responsibilities respondents had. So in this table, we sorted the most common activities by job description, which is listed on the top row, by job title rather, and the least common activities by job title on the bottom row. So the most common activities for youth coordinators were community outreach, youth leadership development, social media, or communications. The most common activities for youth peer support providers were community outreach, one-on-one meetings with youth, and facilitating youth peer groups. The most common activities for all respondents was program management and community outreach. Across the board, the least common activities seem to relate to clinical interventions. So in this section, we'll provide a quick overview of the job requirements that were required prior to a person entering their position, and then the trainings that were offered once they were on board. When you look at this data, think about how these trainings and requirements entice or prevent the right people from getting into the right positions. So these are the trainings and requirements that were there before the respondents could be hired. So we'll notice that background checks were required in almost all positions, and the driver's licenses were also required in almost all positions. Lived experience is a strong requirement, and lived experience was a strong requirement, which isn't surprising given the nature of the work. And then interestingly, not very many youth peer support provider respondents, about a third, said that peer provider certifications were required before they started the job. So as I mentioned, although few employers required youth peer support providers to already have a peer support certification before they start their job, almost 2/3 of the youth peer support specialists were required to take that training after they were hired. Another training that was offered at high frequency by employers were first aid certifications. And I will pass it on to Bree.
Thank you so much, Alice. So as all of you have heard, you heard a lot of the demographics, really trying to understand who the youth and young adult workforce is, primarily the youth and young adult workforce that utilizes their personal story as an asset for the job, and or the job position might require lived experience in order to obtain the job. So Michaela, you are in the comment box, you mentioned that this is uniquely compiled, and you're absolutely correct. As you can see, we had over about 170, I think it was 178 respondents, and in certain questions, what we did, this is our first round of compiling and doing analysis. We have a lot more data that we haven't looked at. What we did was we picked out these two particular subgroups, youth coordinators as well as youth engagement specialists, because we were looking specifically at systems of care grants, healthy transitions grants, other federally funded SAMHSA initiatives that require a full-time or part-time position or some staffing structure that requires the person to have lived experience. And so we were using terminology that SAMHSA often uses, and we're pulling that information out. So this is our first go-around at it. There is a lot more. We've got some really interesting feedback, even from YMCA workers, about how satisfied they are with their job. But for this particular direct connect, knowing that we're connected to a really large system of care population, we thought it would be best to present this information here. And like I said, it's our first go-around. You probably will be seeing more publications and more opportunities to learn about those other staffing positions that were identified within the survey as well. So I just want you all that are on, you had a variety of different positions and tasks. I saw a lot of employment coaches and things like that. And so there's another whole round of other additional information, but this is a very specific subset of the overall respondent. So I hope that's helpful. So as you can tell, we're trying to understand a little bit more about the career pathway and who is in the workforce and who is not, and the expectations of the organization in order to hire so that we can better support the organizations to either hire more or create better work environments for youth peer supporters or youth engagement specialists and coordinators. And so when we talk about career advancement, it's really important that we think about how a young adult steps into these positions. And oftentimes we, and including myself, start the work as an individual with lived experience. So you start at the direct service, like you're getting help for yourself. And then as you grow in your own ability to be empowered for yourself, then oftentimes that turns to, I can help someone else so that it's not a for them. And then that turns into other opportunities to kind of step up. And when I started in this work, there was really not a career pathway. It was like the minute you hit 21, oh my goodness, can you not work in the field? Do you age out? Like, what happens? And so we've been building this continuum so that people can see growth in it. People can understand that they can stay within the workforce if they wish in this capacity, and there's other opportunities for them along the way to advance. So in this section, we're really going to focus on career advancement. So a question that we asked for young people is levels of work, youth workforces in the agency. So are there multiple types of youth workforce positions within the agency? So as you can see, youth peer providers and youth coordinators said yes. So many of these organizations have multiple types of positions in which that they might, so you might hire a youth coordinator, you might hire youth program specialists, and so that automatically shows that there's multiple types of positions and levels in which these youth and young adults with lived experience can move into, which is exciting because that's what we really want to see. We want to see that there's opportunity for growth. So when it comes to career advancement, we asked a question about, has your supervisor or employee ever talked to you about career advancement? 57% of all respondents said no. So once they got their job, their supervisor or others within the organization never said, hey, have you thought about stepping into management? Or, hey, you're a really good organizer. Have you ever thought of doing administrative work? Like, has never once talked to them. And I'm not saying just career advancement within the lived experience realm, but just career advancement in general. 43% of all respondents said that, yes, someone within the organization has talked to them about other opportunities within the organization. 52% of all youth peer providers are not having conversations with their supervisors about career advancement. So what this is telling us is that youth peer providers, as you heard previously, often receive a certification either pre or post the hiring. Once they have that certification, no one else is explaining to them that as a youth peer provider, you may be able to advance to, say, a supervisor of peers, or maybe step into a youth coordinator or youth engagement specialist role. So if we're not having the conversation, then we're really capping them off and kind of making it feel as if like this is their only option. This is how they can contribute to the workforce. And I think there's a lot of other opportunities that youth peer providers can support. They could be evaluators, they could facilitate groups, they could be supervisors once they have, experience within the position. And so there's definitely, we want to see more conversations happening for them. 51% of youth coordinators and youth engagement specialists are having conversations with their supervisor about career advancement. One of the things that you heard earlier is the requirements. So Alice shared with us that youth peer providers normally need a high school diploma, whereas youth coordinators and youth engagement specialists often, because of where they are hired within the agency, they may require a bachelor's level or a master's. So it's interesting that maybe 51% is, an opportunity to talk about career because maybe their education level allows them to advance, but yet there's still a huge portion that once you're a youth coordinator, no one's talking about what else can you do. And we have seen that youth coordinators have turned into amazing project directors and are running their own kind of youth programs and really just stepping into that kind of project director type role, not just a coordination role. So we also wanted to know a little bit more about satisfaction. We're always hearing that the youth coordinator, the youth engagement specialist, or that youth peer support is often hard for staff retention, that they're quick turnover type of positions, and why not? What about the structure of the position? So we wanted to know, are young people just really dissatisfied with their job, and that's why the turnover is so high? So we asked some questions about satisfaction. So in the red box is the question that we asked young people, and they had kind of a scale from strongly disagreed to strongly agreed. And what you're seeing here is the respondents by group. So 52% of youth engagement specialists or coordinators said that their supervisor encouraged them to talk about career advancement. 70% of youth peer providers said the same, they strongly agreed, and 55% of all respondents either strongly agreed or agreed. The next was, my supervisor has encouraged me to think about additional education. Again, this was the same kind of Likert scale, strongly agreed to strongly disagree, and 47% of youth engagement specialists or coordinators, their supervisors have talked to them about continuing education. 55% of youth peer providers, and 36% of all respondents. I have seen in my own work, both locally at a local community level as well as nationally, is that oftentimes a youth peer provider position requires a high school diploma, and when the young adult steps into that position, oftentimes we do see an area of interest of like, maybe I want to be a case manager, maybe I want to go to school and get my degree in human services. And so sometimes stepping into these positions really encourages them to get on a real career track. And so, because they want to aspire to more, and they want to be a part of the workforce, and this is a great way for them to enter. But if we don't continue to have these conversations and support them with additional education or additional certifications, it's hard for them to advance within that career pathway. So I was really excited to see 55% that someone talked to them about thinking about additional education. So next was really focusing on organizational support. Does the organization have program and policies that help youth workers advance in their specialization? Respondents by category were strongly disagree or agree, or disagreed. So 33% of youth engagement specialists and coordinators said the organization did not have programming and policies that helped them advance in their position. 16% of youth peer said the same, and 24%. So this really goes back to that organizational culture. Oftentimes when we think of professional development, in many agencies there's not money for professional development. There's not opportunity to learn more skill. In certain professions, the responsibility to pay for continuing education credits is on the person wanting to maintain their license. In these youth positions, young adults are not paid a lot. You heard from the surveys, less than 40,000 in some positions and less than 30 in others. It's really not a livable wage to really sit here and start investing in their own programming to kind of build their own knowledge. And so without the support of an organization, it's really hard for them to receive additional training or support. And without the policies for that, it's really hard for them to see some advancement and growth. The organization is a good place for youth workers to work. Again, this was a strongly agree to strongly disagree. And 73% of youth engagement specialists said, yeah, the agency I'm in is a good place to work. And then 74% of peers and 63% of all respondents. So this is really interesting to me because when we work within the field, we hear mixed reviews. So when I see the numbers and I saw 73, 74, I was like, oh, that's a little on the higher end. Because we hear from some youth engagement specialists or coordinators that it's really hard to work in state government. And so when you really think of the different factors of state government and the bureaucrat, the policies, the red tape, there's a lot there that a young adult with lived experience has to understand and navigate in order to feel comfortable within that position. But then again, on the flip side, when you get your foot in the door for state government or county government, like that's a real nice career path. Like you get good benefits, like there's other kind of perks that come along with it. So it'd be really interesting to really do some more qualitative work to really understand the workplace and what a good workplace looks like. What are those versus just kind of asking on a scale. So we're curious to learn more there, and we probably will do some future work. So employer support. Administrative leadership talks about the value of the youth worker. And so this is really important because really leadership sets culture. And when we have a culture that is sees the value added in lived experience in positions such as these, that really ripples out into the workplace climate. And so 61% youth engagement specialists and coordinators felt that their leadership saw value in the work, and 63% of peers versus the 54% of all respondents. And I think that would really go back to some of the data that Alice was presenting in regards to employed, like how they're employed. Are they within a family-run organization, or community-based mental health program, a peer-led or consumer-led organization? I think we'll do some additional work to kind of look at what type of work settings probably that have leadership. So we dig a little deeper on this particular question. So looking at the employer support in the work culture is, have I been treated differently because of my lived experience? Again, anecdotally, we hear from youth coordinators all the time. They feel that they're just kind of low on the chain of command. People don't take them seriously. And then when you ask them why, oftentimes it's like, oh, because my lived experience, or people know too much of my story. And so here we have the same kind of strongly disagree to strongly agreed. And 20% of our youth engagement specialists or coordinators said that they have been treated differently on the job because of their lived experience, while 5% of youth peers said they've been treated differently compared to the 15% of all respondents. So again, youth engagement coordinators, they are in a little bit of a different position. Oftentimes they're hired at a higher level within the system, but they definitely feel that their lived experience at times might hinder how they're treated on the job, which is something we all need to be mindful of as employers, supervisors, and directors of programs. So to kind of build up that a little bit, we had two additional statements. When working, I sometimes hear offensive jokes and stories about youth. And the next question was, when working, I sometimes hear offensive jokes and stories about people with lived experience. And so, again, you see 18% of youth engagement specialists and coordinators are hearing something offensive about youth. And their primary role is to support youth, and we're supposed to work within a strengths-based system, as opposed to 14% of all youth. And then hearing something offensive as it relates to someone with lived experience, that came in at 11%. So it's really hard when you are the only or one of a very small team of young adults, professionals that are utilizing your lived experience to be advocating on behalf of other young people, to be in a workplace where we use slang or we're, talking about a particular family or a particular young person, and when people around us are talking negatively, that really kind of sets a tone. And those with lived experience, that when you hear that, it's off-putting, because we think that results in how much they value their perspective and or how much support they may put into the relationships they have. So we just need to be really mindful of that within the workplace. So the next set of statements, respondents by category strongly agree or agree with the following statements. Youth workers are considered the least valuable staff, or at the bottom of the letter. So you'll see there 33%, which results back to a little what we said earlier about youth coordinators, that they're involved within the workforce, but they do feel that they're kind of lower in regards to their value. 26% for youth peers versus the 23% for all. We did ask, did they see hope within their career pathway? Youth worker positions are a dead-end career, and we came in at 16% there. For youth coordinators to 11%. And then youth workers sometimes have positive opportunities other staff do not have when it comes to career development. So they definitely scored higher on this, 37% versus the 21% and then the 28%. And I do have to say, as an advocate for youth and a person with lived experience, when I came into the workforce out of college, specifically working in the system of care, the grant requirement allowed me to receive a lot of professional development that was available to me because I had to travel to a lot of these required conferences, and SAMHSA has done a great job that says these are the 10 people that need to go, and a youth member or a family member is always on that list. So that did open up a lot of professional career development that I got early in my career that wasn't necessarily available to care coordinators, to other direct service professionals within the agency I worked at. So I do see that there is kind of this opportunity at times, but again, that was not because my agency was investing money to send me to a training. It was because it was a contracted grant requirement, and I think without the grant, I probably never would have gotten those opportunities. So that was a lot of data, and we wanted to really open it up now to really kind of chat with you. As I mentioned, we do have a lot more data that we haven't fully synthesized, and we are hoping to continue to look through the data, use the data to kind of shape some of our programming at Youth Move National, to inform some of our technical assistance that we offer to communities, and to continue to build support structures in place for these positions that require lived experience, such as a youth peer provider, the youth engagement specialist, and the youth coordinator. So we have a couple discussion questions that might get us going here. And if we'd be able to kind of open the lines for discussion. If not, put your question in the comment box, and then one of us from Youth Move National will be able to answer the question for you. Don't be afraid to ask questions. This is a lot of information.
We're very friendly.
Okay, so we're going to keep the lines muted. So
we do have a couple folks typing, though. So if you type into the
Perfect.
chat box, I'll be sure to catch it and jump in.
Excellent. I see Monica and Michaela are typing, so that's exciting. And Gwen. Oh, I'm excited when it goes to multiple attendees are typing. This is good. Okay. Okay. So Michaela has a question that is, what do you think is the most important for a person with lived experience to convey through their professional and life development? So Lydia, do you have a thought to that? If not, I can chime in.
So I'm wondering, I'm assuming, and Michaela, feel free to type away again if I'm assuming incorrectly, that you mean what is the most important thing for a person with lived experience to convey, like, on the job to the person they're supporting. And I think that's a sense of hope that, you know, there is a way to live life as yourself and to, you know, have a life that's yours and worth living. I think that sense of hope is very important, and being a living, breathing example of, you know, been there, done that is very powerful.
Lydia, that's great. I think I would agree with you that when I look back on my kind of entering in my own personal journey in the mental health system and then entering into the career force, I think that our lived experience does not define us. Our lived experience within the right setting is an asset to the job, but it should not prohibit us from advancing to other particular positions that we desire. And so that has just been kind of something that's always stuck with me, of like, certain positions you're supposed to be very open, and then if I ever wanted to jump into, I don't know, a direct service position and be a clinician, like, there's guidelines there that you don't share as much. Well, I've already shared so much of my story. But so really just thinking that shouldn't define and it shouldn't limit your career opportunities. So we have another question from Monica. This is great information that we're sharing today. What is the projected outcome you hope to have on the workforce as a result of your finding? Great question. So we are just in the process. Our Youth Best Practice Committee that helped us develop the survey, we will meet with them. That is a group of young adults, as Lydia mentioned, as well as supportive adult allies and researchers from around the country that join in on that group. We'll be working with them to look at the findings, find ways to disseminate the findings, whether that's in professional journal, whether that is issue briefs, whether that's supporting with technical assistance. There's a variety of ways that we'd like to use this information to inform the field. We're hoping to use information to support supervisors and managers that might be doing hiring, as well as continuing to support youth and young adults who are in the position so that they can see that there is momentum within if this is a career pathway they'd like. And so sometimes it's hard for the individual employee to advocate for themselves, and so we're hoping that this information will help us as a national organization help solidify the workforce, the needs of the workforce, and continue to see that as a positive gain. Do you want to read the next question, Lydia?
Sure. I would also add to your statement that one thing, and I'm sure this will come up with the best practice committee because it has before, is looking at particularly the disparities amongst, you know, who we know is accessing or being pushed towards certain systems and who we know is who's currently providing peer support, and sort of, as Alice said, diversifying the workforce and sort of supporting communities that need to see themselves and have those peer providers lifted up and sort of trained and ready to meet that need. So I think knowing what training needs and sort of what diversifying needs are out there so we can respond to them. Gwen White says the idea that leadership sets culture jumps to mind in terms of current needs, employers and organizations. Supervisors and administrators have an obligation to set a positive culture. We agree. Well, I'll say I agree. I would imagine Bree agrees as well, but I'll let her say it. Yes. We agree that very often I would say we see folks who, you know, floor staff or folks who are sort of doing the direct service work are trained, and then we know that they need to be held and offered support to sort of maintain those expectations of behavior and sort of knowledge and how they're treating folks and what they're you know, how they're perceiving young people with lived experience. And so that supervisors and administrators are part of that answer, sort of setting the tone and kind of setting that bar high, and then supporting people to get there.
Absolutely. And I think that one of the things that we have to think of is this is an emerging workforce. Like when I graduated college in 2003, I wasn't thinking that I was going to put on my resume looking for a job that, all my lived experience. This is very kind of a niche workforce that has been emerging over the last, 15 years or so. And I think the other piece with the leadership is that sometimes the organizations that are not within this innovative system of care funding or this federally funding initiative that's asking for these particular positions, they tend to be very black and white in their thinking because they are clinical direct service agencies and they really go by the book, or that they're held to a high licensing standard. And so they often use that as a reason why they can't shift policy or why they can't be innovative or why they're not willing. And we've had a lot of situations where Youth Move has provided really great technical assistance to say, you can still do this and not violate your contracts or not, overstep licensing. And so how we can help you do that so that you can stay innovative within the work but still fall within your kind of traditional business approach. And there's lots of ways to do that. And without leadership buy-in, that's a lot harder to do. And so we've seen a lot of leaders that are very black and white and are not willing to sit down and negotiate kind of the expectations of the job. It's either an all or nothing, you either qualify or you don't. And so that's some things that we'd like to change and continue to support directors with and CEOs at agencies. Okay, it seems like that is the last question we have. I'm wondering if anyone else has some additional questions. Feel free to chime in. We definitely have more time. Okay, so Monica typing. We'll wait for another question to come in. Okay. Okay, Michaela, excellent question. How do you define yourself, or how should we instruct our youth to define themselves? So I identify in true transparency. I've been in the movement for a little while. So I'm in my mid-30s. And I no longer identify as a youth, obviously, but I do identify as a supportive adult for the young people and an advocate for youth. I am a trauma survivor, so that when I am doing trauma training, I do identify as a person with lived experience who has experienced trauma. That is my personal comfort level. That is where I feel most comfortable. I don't like to speak on behalf of all youth because I'm far removed from that system. But Youth Move National has also created an amazing guide called Youth Advocate to Advocate for Youth, which talks about a continuum that allows a youth that starts off as a young person, as a service recipient, and once they kind of master that, and if they have a desire to give back and to support others, how do they then step into this kind of skill-building journey of defining themselves, sharing their story, supporting and advocating for others, all the way up to I'm a supportive adult. We have a really great webinar on that we did in partnership with Portland State University. We have a really great workbook that defines each one of those stages. And so I'd strongly encourage you or to reach out to us at Youth Move National. We can get you those resources. It's also a training that we provide. There's a webinar you can watch, and I think utilizing the language within that guide would be really helpful for you at your agency to then inform young people. If they can say, hey, maybe in this part of my life, I'm a young person with lived experience, but when I'm sitting at this table, I might be a youth advocate. And they can be more than one, depending on the activity that they're participating in, but allowing them to choose language on how they feel their experience fits is probably best, and we can get that to you. Okay. Let's see, is there another question coming in? Did I miss one? Oh,
yep. So I think Monica shared that she is a therapeutic foster and adoptive parent, and wondering if we know specific organizations that offer scholarships or special work opportunities for youth with lived experience. And Monica's in Richmond, Virginia.
So, Monica, I don't know the answer to that question. We do have a Youth Move chapter in Virginia.
And I believe they offer a training institute, or like the annual training. Yeah.
Yes.
So we can connect you with them.
We could connect you, Monica, with your local chapter, and your local chapter could share what free professional development opportunities are available. As a Youth Move program, they offer some pro-social leadership and advocacy activities on a monthly basis that they could just get enrolled in those. But if you're looking for something very, very specific, I think our local leaders would be best to guide you as they know your community best. But please reach out.
There's a foster care alumni organization in that area.
Yes, we could double check that.
Yep.
So Monica, our emails are at the end. Just feel free to email us so that we have your contact information and we could coordinate who those people are that you might want to check in with.
And then Sarah asks, do you anticipate funding in the near future to support the hiring of lived experience and or youth workers?
So
we try not to anticipate funding, I think.
I know.
Very safe.
So all I can say is that, again, in this administration, when you talk about funding, there's always a lot of foundations that are looking to fund programs that support the next generation. And so by supporting the next generation, you might be supporting the hire of young adults within those foundation and those grant programs that you might be pitching to support others. There's always federal funding that comes out. Like currently there is the expansion grant for systems of care. That does not require a full-time FTE. What it requires is that the grant program itself is youth-guided and family-driven, and it requires you to identify a task lead. So who is that point person that's going to be coordinating the youth-guided activities, which in retrospect is in order to have a person coordinating those activities, you're probably hiring a person. And so there's federal grant programs like that, Healthy Transitions. Those federal funding sources, I think they're going to be awarding another group soon. Those all do require a paid position with lived experience. The foster care alumni, so the Children's Bureau does put out some federal funds that require the hiring of lived experience. And so I think that there's several different federal funding sources that are now requiring it and or providing guidance on how to do that. But I don't know their funding cycle and the frequency of that. I do know right now a new system of care expansion FOA is out, and that that's a great opportunity to build your workforce both for youth coordinators, youth engagement specialists, as well as develop a direct service component related to youth care support. And those funding announcements are always available. If you are on the TA Network email list, which I'm assuming you registered for this, you probably are, they try to announce those funding sources on a pretty regular basis when they come out, so on their distribution list, and I would just look at the requirements for that. And if it doesn't require it, be innovative, and as your community, you could set the bar and you could require it.
Not a problem. So Bree, Jasmine asked, what are things that adults can do in agencies to make programming and policies feel more supportive? I'm assuming supportive of youth peer providers. Again, type away if I'm assuming incorrectly. Yep. Okay. So to make programming and policies feel more supportive of youth peer providers. I think the first thing that jumps out to me is understanding and sort of reflecting in policy and program, particularly maybe in supervision or in other hierarchical pieces, that youth peer providers bring their lived experience to work as part of their job, and as such do need special considerations around the accommodations and things to meet expectations. And while they're learning, many young adults, this might be their first job, things like that, they may not know the expectations, but to ensure that the expectation of the employee hasn't changed, but how we support them in learning that and getting there may look different than other employees with or without lived experience. So there are special considerations, but the expectation of job performance is the same. Bree, do you want to add?
Yes. Yeah, I think other things that I've seen in agencies is, for example, one agency that I was supporting, they were looking to build a direct service youth peer support component within their wraparound program. The agency was a traditional mental health agency under licensing with Medicaid billable, and they had language in regards to a criminal history. With a criminal history, you couldn't accept jobs within the agency. So it took some negotiation with HR in regards to trying to figure out, are we excluding everyone that has a criminal history? Are we, looking at anyone that has a certain type of criminal history? Because those with lived experience perhaps may have a charge in the past. They may have a part of their personal story that, it sucks, but it's not going to get off their record, but it doesn't mean that they're disqualified. And so with that particular agency, between the development of the program, the negotiating with the contractor for the state, with negotiation with HR department, we were able to identify that there was some flexibility. If a young adult was hired for a peer position, there was these are okay if you have a criminal history, these are absolutely not acceptable, and we were able to get that approved. So we shifted that policy, which opened up doors a little bit more. Other things is also working with your HR department to look at your hiring practices. We all know that there are very rigid expectations and laws that we need to follow for hiring. So it's really hard to come out and ask someone, hey, what's your lived experience? I didn't see it on your resume. Tell us your diagnosis. That's all protective information that employers really shouldn't know, except for particular jobs. And so it's really important how you advertise for the position, perhaps how you're framing your interview questions, so that way you're not coming out directly and asking, but you are using some situational questions that might get the individual to open up. And so those are some things to think about. We've had other, Glenn, that's a good one. We have had other organizations that driver's license is required. So for some positions, there has been stipulation, like if you don't have your license, you can still get the job, but you must get your license within 6 months. Or some agencies are like, you don't have your license, you can't do the job, where other agencies don't want youth peers transporting the client or the individual that they're working with. So again, a lot of these practices are agency specific. Youth Move has provided technical assistance to a lot of agencies. We have a lot of good examples that if your agency is struggling, we'd love to help you better understand what others have done to ease the burden if you're looking to hire those with lived experience. And I do think the point you brought up, Lydia, is that supervision does sometimes feel supervision/coaching in regards. I think that's a big one. And so there is kind of a setting the standard for the job, but also supporting them through maybe what they might be challenging with at that time, and some flexibility around that.
Absolutely.
and making sure that all of these young people have a well-paid job with health benefits so that when they enter into the career force, they can still take their medication, they can still attend their own therapy, they can still maintain their own wellness plan. And so a lot of agencies that aren't paying well or perhaps only hiring part-time so that they don't have to pay benefits, that all hinders the well-being and the of the individual in the workplace. So just being cautious of that.
Are there any additional questions or comments? All right, this was an amazing presentation, you all. Just thinking about some of the information that was presented today and thinking about when I was a coordinator locally, just around the requirements for the youth workforce, having to advocate around the youth with driving records, especially youth who come with JJ experience. Even now to education requirements are all things that we had to kind of figure out in our local community. So this is really helpful information. And I want to thank our presenters for staying with us and presenting this lovely information. Again, I want to remind you all, oh, I'm sorry, you guys have a couple more slides.
Oh no, Jasmine, you're just kind of wrapping up, and I just wanted people to have our contact information.
Okay. I would like to remind you all that to stay on for a few minutes and give us feedback on the feedback form. The survey will be dropped in the chat box. And thank you all for participating today in February Direct Connect. The next Direct Connect will be in April, and that will be on developing focus groups. So look out for the link and information for that.
And Jasmine, just one other thing, just one extra plug. For those of you that were on the session today or have coworkers that will be at the USF Children's Behavioral Health Research Conference next week, Lydia and I will be there in person, and we do have a session on Wednesday that will be looking at some of the survey results. So if you have additional questions and want to stop by and say hello, feel free to see us in person.
We're friendly in person, too.
We are. And we love feedback, so take the survey.
We love data.
Great.
Great.
Well,
thank you for having us on today.
Thank you, everyone.
Thanks. Bye-bye.
Lydia and Jasmine, are we staying on to do a wrap-up?
I don't think so. I think we're good.
Okay, perfect. Have a nice night.
Thank you.
Bye.